Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is twofold. First, we are thankful to the volunteers and team members who made Saturday's vaccine clinic possible. Once the state made the announcement to allow the 75 and older, those 75 and older to receive vaccine beginning January 1, our team moved quickly in a matter of hours to create an opportunity where those individuals, as well as the folks in phases 1A1 and 1A2, could get vaccinated. Thanks to the hard work of these volunteers and team members, 500 people received the COVID vaccine on Saturday. I want to stress the significance of that. 500 people who are considered high risk and vulnerable because of their age or what they do for a living were able to receive the vaccine and get protection against COVID-19. That number doesn't include the other pods or points of dispensing that we've had where we vaccinated those first two priority groups. The other important point we want to continue to make is that this clinic was not the only opportunity to receive vaccine in our community. As we said we would do, we continue to deploy multiple strategies to provide vaccinations to our community, from large clinics to scheduled appointments. We acknowledge that some opportunities will be better suited for certain populations, while different opportunities will be preferable for other populations. That said, yesterday we opened up more than 200 scheduled appointments for those 75 and older here at the health department. As expected with the high demand, all of those spots were filled in a matter of hours. We will announce additional opportunities for vaccination as we receive more vaccine. That brings us to our second component of our moment of gratitude. We are incredibly thankful for the hardworking members of our public information line. We have experienced an incredibly high volume of calls over the past several days. And these folks have literally answered the call to provide information on vaccines, scheduling appointments, sharing guidance on quarantine, isolation, and testing. For those who have been trying to reach our phone bank and have experienced a long wait time, we ask for your patience. Our team is working diligently to answer as many calls as they can while providing meaningful information to those with whom they are speaking. In addition to that, I believe we're adding some more lines to our phone banks to accommodate those needs as well. That said, we are encouraged by the number of people who have expressed interest in getting a vaccine. That's exciting, as it will take the majority of our population, our community, receiving the vaccine to provide protection and to effectively reduce the burden of disease in our community. As we have said, when we receive more vaccine, we will continue to announce more opportunities for qualifying individuals to receive this much anticipated protection. That said, it's important to remember that we are just one of the many providers who will eventually be making vaccines available more widely in our community. Think of this like testing. At the beginning of the pandemic, KCHD was the main source for testing because it took time for it to become widely available in the community and for others to stand up their testing. Now that's no longer the case. The best and most effective testing and vaccination strategy involves multiple distribution points. So we eagerly look forward to the day when there are more options for folks to get vaccinated in our community. That might be at a pharmacy, at their private doctor's office, and even with us. We'll continue to be part of that solution, but not the only part of that solution. And even now, hospitals are vaccinating, but they're mostly vaccinating internally and not very publicly facing at this time. As hard as it can be, we're asking you to please be patient. We will receive more vaccine, as will other entities in our community, and there will be opportunities for you and your loved ones to get vaccinated. We know that demand will likely outpace supply for a while. I'll say that again. We know that demand will likely outpace supply for a while. So please know that it will take time to get our community vaccinated and that we are pushing vaccine out as quickly as we get it. Just as a reminder, we've only had vaccine physically in our possession for 2 weeks as of today. So I think we've done an amazing job of getting that vaccine out and being diligent about doing so. We will now move to the local situation. For our vaccine update, we continue to provide vaccines to those in phase 1A1, 1A2, and those over the age of 75 and older. We have 170 new confirmed cases since yesterday's report, 4,918 active cases, 205 Knox County residents are currently hospitalized. And sadly, we have 13 additional deaths to report today, raising our total to 346. This is the highest number of deaths we've reported out in a single day. As we have continued to say, we urge you to remember that these are not data points. These are people. Today, we are reporting that 13 additional people have died related to COVID-19. That's 13 families who are beginning 2021 without their loved ones. As always, our hearts are with their families during this unimaginable time. Sorry. Please think of these families when making your decision to wear a mask, physically distance, and avoid gatherings. Please also think of our healthcare workers who are caring for those who are sick. As you can see from the local situation, we have a record high number of Knox County citizens hospitalized with COVID. And this will probably continue to be true for another couple of weeks. While the vaccine is encouraging news and we are excited about it, it will take time for enough people to get vaccinated to lessen the grasp of COVID-19 has on our community. Your decisions to follow the 5 core actions now will help reduce the burden of disease until enough people can receive the vaccine. This is critically important. We can see the light at the end of the tunnel, but as we know, it's always darkest before the dawn. Now is not the time for any of us to let up. As we said last week, we urge caution when looking at the lower new case increases over the past few days. Once again, we think this is coming as a result of fewer tests conducted over the holiday weekend. We expect this number to increase over the coming days. And now we'll open up for questions.
All right, the first question we have is from Alan Sims with Inside of Knoxville. How do you feel about the pace of vaccinations to this point in Knox County? What are the primary obstacles you see to quickly getting vaccines administered?
I'm very pleased with the pace of vaccinations here in Knox County. Our team has worked diligently to put together closed pods to target those high priority folks based on their occupation. And as I said, the state added, or actually the Advisory Committee on Immunization Practices added the 75 and older, and the state decided to go along with that. We quickly put together a clinic. It wasn't perfect, but we put together a clinic for Saturday to get more people vaccinated. I cannot overstate how excited our team is to get people vaccinated. We know that is going to help us as a community recover from COVID-19. So I'm pleased with that. And I'm pleased with the progress we're making. I think the biggest challenges to vaccinating and getting people vaccinated, one has been people showing up. So we've had people who have an appointment, a vaccine reserved, and they haven't shown up. So we're shuffling that vaccine around and making sure we're using it. We're not wasting any vaccine, but that we've added some appointments for tomorrow. And that'll be rolling out. Again, those are closed pods. Those will be rolling out to healthcare workers and first responders, hoping to get some of those folks vaccinated. So that's a challenge. The logistical challenge with this vaccine and the Pfizer vaccine, the Moderna and the Pfizer vaccine, is the storage and vaccine handling is a real challenge. A lot of very specific timeframes that we have to follow. Our team is accustomed to that with our flu mist clinics. So they're doing a really great job of managing that vaccine and not wasting any doses. They really understand the importance of using every dose that we have. So I'm really proud of that.
Another question from Alan with Inside of Knoxville. Many people have expressed dismay at the idea of elderly, potentially frail people standing outside overnight or for hours in the early morning, as happened at the expo hall. How do you feel about the event, and will future events be similar, or will you make changes?
Again, I'm really pleased with the event. I can't say often enough, 500 people got vaccinated in about 3 hours. So that was really great. Prior to when we announced the event, we stressed to everybody, the media, our communication partners, the public, that this is not the only, that was not the only opportunity for people to get vaccinated. If you're frail and can't stand in line, that's not the ideal place for you to go. That's why we opened up appointments here at the health department where people can just park and come in, and it's a lot easier for those who are frail. We will continue to offer a variety of ways for people to get vaccinated. People need to look at those and make a decision about what's the best way for me personally or whomever, somebody I'm helping, to get vaccinated, what's safest, what's most appropriate for them. And certainly people did make the choice to stand in line, and understand there were folks out there handing out blankets. We appreciate that support. But we probably will have other similar events in the coming weeks, but we'll also have appointed opportunities and others as well. So we know that if we offer vaccine in a variety of ways, that's just going to increase access, because not everything we do works for everybody.
Another question from Alan with Inside of Knoxville. What percentage, even a gross estimate, of nursing home residents have been vaccinated in Knox County?
Well, we honestly, we are not vaccinating the nursing home residents. That is being done through a federal partnership with Walgreens and CVS, and the State Department of Health is coordinating some of that as well. I do know that it has begun in Knox County, and what I also know is that almost all of our assisted livings and nursing homes are signed up either through Walgreens and CVS or other partnerships to get their staff and residents vaccinated. And it has started, so that's exciting. We certainly want to protect that vulnerable population.
Another question from Alan with Inside of Knoxville. Do you anticipate that testing will return to previous levels, allowing us to get a more accurate picture of the level of spread?
I do anticipate as offices open back up after the holidays, as we are here more after the holidays, that we'll see testing go back up. And so, yes, I anticipate that we'll have a better idea of disease burden in our community in the coming days.
From David with WVLT, how smoothly are logistics running for vaccine distribution? Is there any hiccup in the supply chain that is impacting Knox County and specifically?
So one of the things that's always a challenge is that we don't always know how much or what we're going to get from the state. Because the state is coordinating allocation of vaccinations across the entire state, and that includes for nursing homes and every citizen in the state. So it's based on population and based on use. So we are in continuous communication with the state, making sure we know and have an idea of what we'll be receiving so that we can plan better. So that's one of our big challenges, is knowing what we're going to get so then we can plan. We don't want to plan an event and then not have vaccine to administer.
Also from David with WVLT, is Knox County getting vaccines at appropriate times from the state? Should it be quicker or slower?
Everybody would like vaccine to come out more quickly. And we'd like, just to have our, 470,000 doses, and know for sure they're going to be here tomorrow. It's not how it works. It's never how it works. It's not how it works with flu vaccine. We have years of experience with flu vaccine and flu mist and starting and stopping and waiting for vaccine to get here. So there's so many logistical pieces that happen well before it shows up on our doorstep that we have no control over. What we do is plan, and we're ready as soon as we have that vaccine to implement those plans and get vaccine out and get it administered as quickly as we can. And that is the best we can do, and that's what we'll continue to do.
From Brian Hornback, are vaccines arriving daily, weekly, etc.?
Right this time, we don't have a regular scheduled distribution of vaccines from the state. We're hoping that we'll get into a stride where we'll get at least shipments weekly. But right now, again, they're trying to spread it across the state, and they're trying to manage the limited amount they have to cover the most vulnerable and those at highest risk. And they're doing a really good job. They're very diligent in that, and very diligent in making sure that they're getting vaccine where it needs to go. They've prioritized some communities that have been harder hit, even harder hit than Knox County, some of our smaller communities. And so I really applaud the state for the job they're doing. It's a mammoth undertaking.
From Cole with WBIR, is the total or confirmed case count more representative of the local situation? Total has probable in it.
Okay, so then the total is more representative of our case count because it includes the probables. Thank you, Kelsey.
From Austin with WATE, we've heard from people who are upset about being in a qualifying category but not being able to get a vaccine appointment. Can you offer them any better idea of how long they'll have to wait?
I really sympathize with that, and I understand it. And I'm happy that people want to get vaccinated. One of my concerns has been that we won't have good uptake. And if we don't have good uptake, we don't have good community protection. So I'm excited that people want to get the vaccine. I know people are frustrated, and we sympathize with that. The best thing I can do is say, be patient, check our website, pay attention to these media briefings. We'll be announcing opportunities for folks to get vaccinated in our community. As we are able to do that, as we know we have vaccine, we'll be able to do that.
Also from Austin with WATE, how many appointment requests did you receive and how many were you able to fill?
Well, we had over 200 appointments available. Those all got filled. And honestly, I don't know how many appointment requests we've received.
How many operators do you have to handle the calls? Another question from Austin with WATE.
I'm looking around the room. Currently we have 8. We're going to be adding some, and I'm not sure how many we're going to be adding. We're going to be maxing out our capacity in that area. Right. It's not just pulling people in. They've got to get trained and be brought up to speed on the current situation and how to guide folks. And these aren't simple yes or no phone calls. These are folks calling in with questions and concerns. And you can imagine when we tell somebody the appointments are already filled, they're not very happy. And so our staff is talking to them, trying to help them understand that there will be more vaccines soon. We just don't know exactly when that'll be. So it can be rather involved conversations.
A follow up to that, Austin asks, have you asked the state for more help with that?
No, we actually haven't. That's really local. The reason that's local is because we know what we're doing and we know our capacity. And so keeping that local enables people to get the local information so that they're more up to date on what we're doing here.
From David with WVLT, can we get an update on flu numbers for Knox County so far this season?
So flu numbers are always interesting. Flu is not reportable except for pediatric deaths and pregnant women who die from the flu. And so we don't track flu numbers. What I can tell you is the influenza-like illness, which is an indicator of flu activity in the community, those visits are lower than normal right now. And so we are, not surprisingly, other things have gone back up. And one of the things we believe is that following the 5 core actions is helping keep our flu numbers down. Flu is a respiratory illness, much like COVID. Spread very similarly to COVID. And so following those 5 core actions, social distancing, wearing a mask, washing your hands, staying home if you're sick, and cleaning surfaces regularly is helping all of us stay healthier, not just from respiratory illnesses, but probably from some other things too.
From Brian Hornback, he says, to reiterate, the only contact for KCHD for appointments to obtain vaccines is the public information line at 215-5555.
At this time, that is the only contact for appointments. We plan to expand those opportunities.
From Cole with WBIR, I understand many folks want to know when they'll be able to get vaccinated at KCHD, and that depends on when you get more vaccine. Can you help us understand how the process of getting more doses works? Who puts in the request for more doses? Who must approve the order? How long does that process take, et cetera?
So let's start at the vaccine manufacturer. So the vaccine manufacturer has to make the vaccine, and then that vaccine manufacturer distributes those vaccines to the federal government, and the federal government allocates those to the states. Actually, they don't go to the federal government, they go to a distributor. The states allocate those out to the counties. So that's a process. So there has to be enough produced to go. And again, the federal government is allocating for the entire country. And that's a big undertaking. And so then here, sometimes what happens is we get an email from the state saying, let us know how many doses you need, and we send back how many doses we need. Or we proactively reach out to them and say, we need this many doses, and they tell us if they can fill the full order or if they can just fill part of it. That goes through the state's immunization program, and those approvals are made through that program. And that's actually how we distribute flu vaccine and lots of other vaccines as well. So it's not new, it's not different. It's the system we use. It's just, we're just getting started. I just want to remind everybody, we've only had vaccine in Knox County for 2 weeks. The state has just been distributing vaccine for, I think, maybe 3 weeks now. So we're just getting started in getting vaccine out there. it's a little slow and clunky at the beginning. We'll get into our stride and we'll have regular amounts of vaccine coming to us. We're hopeful that that will happen in the near future.
From Isabel with the Sentinel, one of the factors Knox County Schools uses to make its operational decisions is guidance from the health department. Did KCHD provide any specific guidance in the last few days for if schools should operate in person or not?
Well, as you know, we have recommended that the schools consider changing how they allow for extracurricular activities. So we've been very public about that, because extracurricular activities are just another opportunity for people to gather and share COVID and other things. And the schools have lots of safety measures in place. We do have concerns about going back with our cases. We anticipate that our cases are going to go up. So we expressed our concern that with cases going up after the holidays, in a short time frame, we'll be back in the place where we were before the holidays, where they weren't able to have enough substitutes to be able to hold school and potentially have to go virtual again. So, we totally understand the importance of children being in school and being educated at school. We get that. And the schools have the difficult job of weighing the risk of illness versus having kids in school. And they made the decision to have kids go back to school right now. And we'll continue to work with them on how to reduce risk in the schools and support that decision. But I am concerned that we'll be back where we were before the holidays and having to not have school in person again in the near future. I'm not sure if that would be avoidable even with delaying going back to school, because our disease rate right now for the foreseeable future is going to continue to be high.
Just real quick, eyeballing the questions that are still in the chat feature. We have quite a few, and we only have about 8 minutes left for the briefing. So I'm going to have to cut them after. We'll ask the last question in there from Claire with WUOT, but we won't be able to take any further questions if they're not in the chat feature. Also from Isabel with the Sentinel, schools are back and so are extracurriculars, including indoor sporting events. Is KCHD concerned about how these activities could lead to a rise in cases?
I think I already answered that.
Also from Isabel, do you have a timeline for when teachers in Knox County will be able to receive the COVID-19 vaccine?
It all depends on how much vaccine we get and what the uptake is and the groups that are prioritized above teachers. We are in conversation with the schools about how we'll accomplish that in the most effective ways. So we're planning and anticipating that will happen before too long. Some of that is also determined by the state and when we move through those phases.
From News Talk 98.7, is the number of vaccines available in Knox County listed on the KCHD website? If not, will it be moving forward?
It is not listed on the website. It's a constantly changing number. I'm not sure that we'll be posting that because it changes constantly.
Cole with WBIR, we received a question from a viewer about homebound seniors. Does KCHD have any idea how it or other providers may be able to help reach that population?
So I think the important thing about homebound seniors or anybody who's homebound is vaccinating those people who help take care of them. So the homebound person isn't going out into the public and isn't getting exposed to others except the people that go in and serve them. So the people that go in and serve them need to be vaccinated. So we're vaccinating home healthcare workers and other caretakers need to be vaccinated to protect that person. So that's the best way to protect that person. We call it a cocoon of protection. Vaccinating those people that come in contact with that person so that they don't introduce COVID into the home. And as vaccine becomes more available and is available through private offices, those folks, when they go to a doctor's visit, will be able to get vaccinated as well. But right now, really the important thing is vaccinating those people who are going to be going and providing services.
From Vincent with Knox News, there are 2 approved vaccines for COVID-19, and there are at least 2 more vaccines in the pipeline from the Accelerated Development Project. Do you anticipate getting doses from multiple providers? And if so, how are you accounting for different multi-dose schedules?
So part of that is out of our control and depends on what the state decides to do and what they decide, which vaccines they decide to offer in the state of Tennessee. So right now we have Moderna and Pfizer, and it is a challenge to account for those doses. One way that we can make sure that people get this dose they need the second time is through a system called Tennis. Tennessee, it's an immunization website, and I don't remember what the acronym stands for. And so every provider who's vaccinating people against COVID had to register, and they have to document their doses in tennis. So in the future, when other providers have vaccine, those providers could go in and look and see that Martha Buchanan got the Moderna vaccine, so this time she needs Moderna vaccine, or she got Pfizer, and this time she needs Pfizer for a second dose. So that's one way to coordinate all of that. Our staff, our team really reads and is up to date. The state provides us with lots of information on how to manage the different vaccines. We have a plan for Pfizer. We have a plan for Moderna. Right now, we've had Moderna. We anticipate potentially having some Pfizer. Haven't really heard about the other types or brands of vaccine that are out there. I do know they're in development. But again, that'll be a decision that's made at the state level.
Next question from Austin with WATE. Austin, I believe she answered your question a couple minutes ago. I think Isabel had the same question. His next question was, after the holidays, are testing levels still at the level you'd like them to be?
So we're just 2 days back from the holidays, so it's kind of early to be able to answer that question.
Also from Austin with WATE, what is your response to the bars that continue to stay open after the curfew of 10 p.m.?
You know, it's just frustrating. It's frustrating to see our businesses not caring enough about our community to make some changes and make some difficult choices. We've all had to make difficult choices during COVID. Everything from, missing opportunities and missing trips and losing jobs. And so it's disappointing to see that we have some businessmen and women in the community who continue to demonstrate that they aren't willing to make those choices to protect our community.
Your second question, Austin, I believe she just touched on that as well, related to bars still remaining open after 10 p.m. From Claire with WUOT, are you still distributing the 2,200 Moderna doses you received in the first shipment 2 weeks ago, or have you gotten more vaccines since then?
We have gotten more vaccines since then, and we just continue to distribute what we get. And I don't have an exact number in my head of what we've gotten. We'll have more information on vaccine and how much we've gotten and how much we've given on Thursday.
And Claire's next question was asking how many total doses have been distributed. And like Dr. Buchanan just said, we will make those numbers available on Thursday during our weekly benchmark updates as well. Also from Claire with WUOT, the Hamilton County Health Department reported pulling more doses per vial of the Pfizer vaccine than originally expected. In KCHD's experience, is this true of the Moderna vaccine as well?
There are some vials that we're able to get more than the 5 doses out of. It's based on the number of cc's that you're able to pull out of that vial. I believe that's happening across the country and across the state. So we administer all the doses we pull out of each vial.
All right, that is all the questions for today. We appreciate you all being with us here today, and we will do another check-in, another media briefing at 12:30 on Thursday. So we hope you have a good and safe rest of your day.